Good afternoon. It's wonderful to be here, and I know hopefully we're up for the challenge of following such a high-powered worship service there. And for that, Jim and I maybe we'll start off in talking about what our role is in the Pathways Home project. So as Pastor Karen mentioned, in my day job, I am director of the La Crosse County Human Services Department, which is a helping agency, provides a lot of different services like behavioral health services, aging services, child protection. But what it didn't do is have a role in homelessness response. That changed in the last year when the mayor of the city of La Crosse and the La Crosse County administrator decided to form a local government partnership to address homelessness. So I was tasked from the county side to help coordinate a community plan along with my counterpart on the city side, Brian Sampson. So we're going to talk about kind of the journey and what that plan is today, but now we do have someone in the community that is directing homeless response services, now is delivering the plan that has been created, and that's Jim Drees.
Thanks for being here, everybody. I've been in role since July, so about 7 months on there. A lot of this is what you might consider project or program management. So we've got a complex set of agencies, city and county collaboration, different statutory requirements around various programs. So it's really connecting a collection of amazing resources we have to kind of just get us all aligned, and then to call out the gaps so we can get resources there and schedule it like a big coordinated dance, hopefully.
What we're going to walk you through this afternoon is talk a little bit of background in terms of how the Pathways Home Plan came to be, a little bit about the plan itself and status, and a little bit about the community partnerships, and particularly the faith partnerships that help out with the Pathways plan. With that, we have to acknowledge up front, in this work, we're here from city and county, but we're not here alone by any means. The Pathways Home Plan was created working together with all of the agencies you see up there and even more that really cast a vision for our community to do something different in addressing homelessness. And kind of just say up front in doing this work now what the greatest challenge is and kind of lies forward from our community when addressing homelessness. And would say first, it's not really what to do in terms of how do you solve homelessness for the community and reach that homelessness functional zero and get everybody off the street. Believe it or not, you think, well, gosh, you need a lot of resources for that. You'll never get the resources for that. But seeing that, I guarantee you, the resources exist in our community to make sure everybody has some place to go at night, in a home at night. That's not the biggest challenge. The biggest challenge is how this has to happen. And what we know, it has to happen different than what we've done for the last 5 years and for the last 10 years, what got us to this part to begin with. And that requires change, and that is very difficult to ask organizations to do. So that's a big change for the city and county in terms of even taking this on and how we show up for the community to this issue. It's a big change in terms of helping agencies and how the community works together around this. And that's especially because you always have the pull on, why can't we just do this now? Why can't it be solved tomorrow? What if there was just this killer program? What if we could ask the state for more money? Where at the end of the day, or we've been so reactive instead of strategic about this. When at the end of the day, all of the money in the world is not going to solve this problem if we can't work together as a community. So working together as the community in a new direction has been a challenge because we have a background in homelessness. Walk through a little bit of the history because maybe asking, haven't we dealt with this issue for a long time and hasn't been really bad for a long time? Well, it has. We've gone through like 3 phases as a community in dealing with this issue. One up until 2015, kind of called siloed services. We have wonderful helping agencies in this community that serve the homeless, doing different types of functions. So we had those helping agencies, helping individuals that were homeless, but there was no overarching plan. Just a lot of different agencies, whether that's the Salvation Army, whether that's Cooley Cap or Catholic Charities, doing different things, not connected necessarily or coordinated. As things really heated up and we saw homelessness get worse in our community, we did have some community-led coordination that happened in the 2016 area. Where there was a national homelessness consultant brought in, a local health system paid for that consultant, and really the community led in those nonprofit agencies in trying to have some coordination and do some good things together. And some good things were accomplished, but unfortunately that wasn't sustained. The pandemic came along and we saw a flood of folks on the streets of our community. And then we entered an era that, for not so better words, kind of call a doom cycle. Because what we did is invested a lot of money for a lot of very short-term solutions. A lot of these were like mass housing projects. You may have heard of the Econo Lodge project, or a sanctioned encampment, and that was in Huska Park. And with all of these projects, there was no sustainability thought of after that, and we often left those projects in worse shape than when we started, with more homelessness and without sustainability to carry that forward. So when we came about contemplating a local government partnership for this is kind of what we faced. So we have about 220 individuals homeless in our community. That tends to fluctuate. That's where we started, still about there. Half of those individuals don't have a place to go at night, are unsheltered. So over half of our homeless individuals at that time, many in encampments or different locations because shelters are full, don't have a place to go at night. And again, where we're at in terms of approach, we do have resources in the community, whether it be in housing, agencies that do shelter, really trying to do their best in terms of going out and serving our homeless population. Communities became very frustrated. Continually nothing working, continually local government put a lot of investment in some of those early efforts and begin to ask, why are things worse and not better with all of that effort, with all of that investment? And it really, even though local governments in the state of Wisconsin have been hesitant to get involved in a leadership role in this issue, it's kind of like who wants to take the hot potato when there's an issue that's very complex, doesn't have a great track record of success, but there's this really realization that there's this mounting cost of doing nothing different. There was an ongoing impact related to human suffering and the toll of this large of a population continuing not to have shelter. Heard from the public, really fed up with public safety. When we had large encampments, there was crime flowing through the encampments, that the crime infected surrounding areas. There's a public safety issue. Heard from businesses in terms of a community reputation issue when you have an issue this visible and this size and seemingly not being able to gain control. And there's a huge cost to the community for this issue going on and doing nothing different. It is estimated that if we don't take any different track, we will spend $20 million over the next 5 years on our unsheltered homeless population. This is really good data that comes from the National Institute at Homelessness, quantifies how much it costs the community for each one individual that is outside and unsheltered. And it's about $37,000 annually. So this is 37 annually, the 200 people that we have over the next 5 years. At first, I thought, well, gosh, this seems like a very large number because folks are unsheltered. What does that cost? Well, there's a big cost to our health systems. Unsheltered individuals use the emergency rooms at hospitals at a much, much higher rate of individuals that are even in the homeless shelter. So those are those costs. There's jail and law enforcement costs. And that is a huge cost. And I know Officer Miller here could attest to that. When we had the large encampments, you go down there and see the police down there, a continued police presence. And sometimes what struck me is seeing officers going around with garbage bags, picking up trash from the encampments and doing other things where you'd hope to be out doing something else, but would have to do that. The city would come through and do environmental cleanup. a tremendous amount of costs, all kind of spent in the wrong way because you're sustaining a situation where individuals were outside. So it was a lot of community frustration that came together, and a lot of policymakers that wanted to do something different, where in late 2022, the mayor and county administrator said, I think maybe local government will show up in a different way in this issue and take on a new role with regards to homelessness. What that role is, recognizing there's not funding within local government to just start up something new. There's tax levy and a lot of things can talk about. But there's a real role that we've seen across the country, communities that were successful. Really the key was solid local government coordination that could step up and serve as the backbone for community response. That includes convening stakeholders and creating a plan. That include sharing key infrastructure. We're able to, a big complaint going into it, do we even have good data on who these people all are and how we are coordinating? We have IT within the city and county. We have personnel that can coordinate key things. So using county infrastructure, bringing people together, using city infrastructure to wrap around agencies doing this work. And also providing transparency and accountability. We heard a lot from the business community and others. What are we getting for our money? What's working in the community and not? That's a role we can certainly play. So leading coordination around how we bring our resources together and rowing in the same direction. If there was one thing kind of learned from communities that were successful in research, it was that those communities that had an impact were able to get all of their resources across government, across philanthropy, across nonprofit organizations, rowing in the same direction toward common goals. So with that, during the last part of 2023, a plan was created. That was gathering a lot of input. That was hearing from a lot of stakeholders in the public, in the business community. We held a faith forum as well, reaching out to our faith community. There was a lot of research and really understanding how things currently worked in our homeless response system. And what was really eye-opening about that was how many resources locally weren't being leveraged to their fullest capacity. For example, we found in public housing that many vacancies in public housing were going to individuals from out of state, coming in from Florida and from Georgia, and there's nothing wrong with people moving here, but the public housing had a preference to serve homeless individuals and individuals that were local. So at the same time, we had 100 folks on the street. We weren't filling our public housing because we didn't have applications from those. So that was an underutilized resource. We also had a program, a federal program, that can pay fair market rent for individuals that can't afford rent. That we were returning tens of thousands of dollars each year because that program was not being utilized because there weren't landlords that would take the money to be able to do that. Because the housing market here is very tight, but there's the dollars that exist to pay the rent. So a lot of things that weren't being utilized within our system. And we spent that time preparing key investments. So we created the plan and launched Pathways Home on January 8th last year. So about one year, and I have some plans you can take with you. So launched the plan on January 8th. And a little bit now about the status. So we have the Pathways Home plan, and it is doing things different. It is coordination, everybody working together, rowing in the same direction, and the first time in our community having a true integrated homeless response system. So it changes the approach that let's all try to do our best. Let's harness our resources and work together in a different way. There's the plan. We have 8 strategies. For time's sake, won't go through all of those. There's 12 objectives. One of the main takeaways as a community, we've been able to talk a lot about what we want to do, but we don't have a history of being able to then follow through that with action and implement that. So implementation and making sure we do what we say we're going to do becomes very important. When we talk about what does a system look like, or what are key components, looking at three things. And one, there's no shortcuts for a community. If you want folks not to be on the street, and then you need those housing and wraparound supports for everybody. That includes outreach services. So if there is someone that's on the street, you're able to rapidly respond and say, you know, we have some options for you. You can't stay here, but we can take you to a shelter. Or hopefully, if you're ready for housing, we can get you in housing right now. So good outreach. Enough housing then, so making sure the resources that exist, like in rental supports, that there's enough housing then to put folks in and shelter. And then also, that's only part of the issue. You have to have good case management as well. One of the things that we found during our research of the system as it exists, there was an agency that was very good at connecting folks with public housing. So that's good, but what we found, 70% of those connected by that agency and got into public housing were evicted within 3 months and right back out in the street into the cycle. And part of that is there weren't supports connected and case management connected that is sometimes integral for that to stabilize and to help folks get back on their feet and get self-sufficiency. So the plan has two goals. One, get to a point, and get to this point fairly quickly, where we have 0 individuals living on the street, and reach homelessness functional 0, which means that the system is working well enough where you always have folks that lose housing, but you're able to get housing, so that period of time of homelessness is very brief. Key elements of the plan: local government coordination, resource alignment, resources rowing in the same direction, and what's called an indoor service orientation. That's where, looking across different jurisdictions, a community really has to make a choice. Do you want to continue serving individuals outdoors and allowing that to happen, or are you going to serve individuals indoors? Hopefully straight to housing, but otherwise in shelter. And that is also ending outdoor living as even an option. And that's enforcing the laws that are already on the books in terms of, again, someone's living outside, say you can't be here anymore, but now we have shelter space for you. Now we have options of housing for you. And very important in our community, because homelessness is a statewide problem, a national problem, that our local resources are really staying here and staying local for local residents. The first year of this has really been now putting that system in place. And what that has looked like is now we do have a single, what's called a by name list of everybody that is homeless, what their needs are, that we can begin building the system and addressing their needs. And all of our community helping agencies can work off of that list. There are coordinated processes, like there is case conferencing that happens with agencies around the table. They're able to use that list, and with the resources that we have now, who's helping who, and who is in the best position to take an individual and help them. We found in our research the way things are happening, sometimes you would have a person on the street and there's like 2 or 3 agencies working on the same application for somebody. So now using resources in a lot better direction. And then case management. This is a big one because there are gaps in this system around housing and also around case management. We have started a specialized unit within Human Services in our behavioral health section where this was underutilized. There are state and federal programs that pay 100% of cost of hiring case managers for those with mental illness. To be able to provide this type of case management. Wasn't being utilized. Started the specialized unit to do that. Currently have 3 social workers. We start off with that unit. We're adding 3 more this year, and we're integrating, which is really important to our those who have lived experience. They also have to have peer supports. So we're having peer supports being integrated in that unit as well. 2025, this is going to be a critical year. So if 2024 was we're going to build in this system to get the resources flowing in the same direction, 2025 is when we end the crisis, meaning at the end of 2025, have no one on the streets. Three things. One, increase the capacity in specialized housing. And there are things that are in the pipeline for that. By the end of the year, there'll be 10 apartments available at the county's Hillview campus for those with the most acute mental health type of conditions that wouldn't be successful in regular housing is a bridge there. 14 apartments in a city initiative. And just announced within the last month or so, $1 million of city ARPA funding to launch to create new apartments that will be available. In the next few months, there will also be a release of a specialized housing plan that will be engaging the community to get us the rest of the way there in terms of our capacity needs. By the end of the year as well, because we know we won't have all of the housing that's needed at the end of the year, and not everybody will be ready to go right into housing. So it's important to get the capacity that we need in shelter. We don't anticipate long-term we'll need to have additional shelter capacity, but as we make this transition, that will be important, so everybody will have an option in some place to go to. So this is creating and putting up by the end of the year a temporary increase in shelter capacity. We'll be doing prevention strengthening, and then after that, it'll be about sustaining the gains that we've been able to make. But with that, I'll turn things over to Jim.
Thanks, Jason. So I'm an engineer by background and training, so the data is something I really care for and want to see and make sure we make really good decisions with it throughout. I also come with project management experience, and a couple things about doing program management that are there. One, make sure you understand your objectives, clear scope, resources, and a reasonable time frame. And really with Pathways, we have all of that. I think one of the challenges every project manager has, especially in a longer project, is the world never stands still while your project's going on. And I think especially so, and some of our data will show this. Because of that data being so dynamic, of people moving in and out of homelessness, in and out of our area, working with different agencies, tracking this carefully and understanding is really important. So just a little bit of we do schedule out the tasks and activities, working back from deliverables. Jason talked about those objectives. So, doing that kind of across our system too. So we're integrated and aligned. So some of the data. We started out this past summer putting out kind of a first set of basic monthly data points here. What I want you to know for these next couple of slides around the data is each data point has a name attached to it. There's no one on this list that we do not know a name of in terms of doing that. And so it is all about the people. But we can learn some things about our population. It'll help us figure out what resources they need, what type of specialized housing, and what type of support to stay and maintain housing on there. And I know you can't read it too well, but just a couple takeaways on this. Primarily it's single adults. That doesn't mean we don't get couples or partners as well as families that come into the system. And really, because this population is what we considered chronically homeless, they're a high needs population. At last fall, we were looking that 77% needed moderate, which means multiple times a week support for case management, as well as intensive, which is daily. And a third have a disability, and this is really an undercount. It's a third that have either a physical disability or a medically diagnosed mental health disability. So a lot of them might have mental health issues because part of being homeless, it may never have been properly diagnosed. All these factors go into what it takes to be successful for housing and the support services there. And as we look, I'll go to the next one too. This data is available on our website, so just to give you a sense of what we're tracking. So the first graph up there, just is the total population. It changes every week in terms of doing that. So right now it's about 275 people. Our area, like others across the state and across the country, have seen an increase in homelessness over the last year. Our numbers reflect that. The number we're really tracking carefully for 2025 is that unsheltered number, which is right around 90 right now. And that's part of the temp surge shelter plan. It's really hard to get people stabilized for housing and support services if they have no shelter at all. We're tracking veterans and homeless veterans, and you can see we're seeing an increase in that. That's the middle curve that's up there. Veterans have a unique set of needs, as well as a tremendous level of support through the Veterans Administration and others to get help on there. And the last thing is average days of homelessness, and this was running over 500. Our ultimate target is 30 days, to find someone who falls into homelessness and get them either housed or at least sheltered within 30 days. We're a long ways from that. But you'll see that number's coming down. And part of that reason is, again, the bar chart, I'll just comment, that is people that have got housing through the process. Last year, 88 people got housing. That's incredible. Our numbers went up. You know, as part of the reality, and part of we just have to look at the data, be transparent, and share it across there. We're already starting to see, as we're getting people placed and people are coming into homelessness, their levels of need are a little bit less. So more are now in this light category, moderate category. So that really says it really is of value to get people out of homelessness as quick as possible. It's not good for their health, mental health, substance use, a lot of other issues on there. And we hear again from people who have maybe diabetes and other problems that are chronic that cannot be well taken care of when you're unsheltered. The other chart I'll point out here is that about 85% of people last had housing in La Crosse County. So while there is some flow of people in from other communities, we actually have an outflow ourselves of people coming from La Crosse elsewhere. But these are primarily our neighbors and people we went to school with. So we'll be continuing to look at the data and we'll share that publicly. Again, as Jason said, our big goal is to take that unsheltered population down to 0 in 2025. And I want to talk a little bit about, we've got a faith community group, and Pastor Karen has been part of that. That meets monthly, and there's some sub-meetings. You know, I think there's in the neighborhood of around 160 different faith communities in the area here. And we'd love to tap into that, and not a prescribed way, but collaborate on ways we can be effective. So I just want to compliment all of you. Your awareness, our growing awareness of this, your commitment to be part of this and do something. What you are doing will be an example we can use for other congregations and faith communities. So thank you for jumping into this. Is exactly what we were hoping for on there. So some of the things are Caring Connections. It may be someone coming into housing. There's a program called Neighbor to Neighbor. There's other ways people can stay connected. It was done with refugee resettlement often for congregations. So it's something else where one partner outside of a social worker or case manager, you can really help a lot. Resource collaboration and resource multiplication and innovative solutions. So this will continue to happen as we try to tap into the faith community. There's a lot of caring individuals in our community. And so in particular, where these resources might go, well, we want to get them rapidly to where they're needed most. So one option is flexible funding. We had someone who was on the waiting list for public housing who got in and had 48 hours to come up with a security deposit. It wasn't huge, it was $800 or something needed. We could get a letter that's saying someone would give it, but really, you know, thankfully we were able to navigate that one. But in general, sometimes it's something like that. It's an application fee, it's something else that needs to happen. Those flexible funds are really important. Specialized housing, we've been leveraging infrastructure funding, but as we look at other programs across our community, helping us build and fund specialized housing is important on there. And then maintaining housing, which could be occasional rent support if someone falls behind on rent. It really is much less expensive to pay that and keep them housed. As Jason said, if they go into the unhoused situation, our community will have a larger cost. And then search shelter. As we talk about that, that will have expenses for us to do. So those are all ways we will do that. Specifically, the funding from this congregation, that will be discussion as we get closer. It'll be used where we can make the most impact working with you on that. And so thank you. Thank you for your interest, being part of the journey. Pastor Karen, is there time for question and answer? Then we will open it up for questions. Questions? Yeah.
Nope, actually, this is the city and county together. So this plan is city and county. It wraps around and it includes other agencies, but as far as the leadership of it, it's city and county together. We are co-equal partners in terms of owning the plan. Yes. Yeah, well, that's a good question, and yeah. Yeah, and that has been a concern in terms of, well, we have local resources. Are we keeping those local? Would say a few things to the extent that that's happening. And again, it's nowhere near a majority of the population. It's a very kind of small part, but that's happening now because when you have a situation of unsheltered and folks to be able to sleep outdoors and sometimes in mass encampments. That draws people to be able to do that, especially for communities where outdoor camping is not tolerated. So right now, we have inflow of folks from surrounding communities that do that are very costly from our community. So I'll say that's happening now. When everything's set up for that, for one thing I would say too is there's individuals that come to this community for good schools, for good things. So if there are individuals that want to come to the community because, gosh, I want to get kind of life in order, I want to get a job here, I think that would be okay. But there will be also things set up. There's going to be coordination with surrounding communities. There's going to be a communication plan. There's going to be eligibility that are around some of these things. So we don't anticipate that will be a big issue, and it's certainly no more than it is now. Say, yeah, good question. Right now, the very much, almost all, I would say vast, reside in the city of La Crosse. And there's where this partnership starts and is so important that city-county partnership. And I think that's a lot of benefits in terms of being able to serve folks rapidly. And again, instead of really scattered in the community now in a single sheltering situation.
Like if you lived in West Salem and you had to live in your car for 14 days,
Yeah.
like that's not good. But if you could get back out of homelessness and not have to leave West Salem or wherever and be in La Crosse and Main City, I think that's a big part of it.
Right. Derek.
So one of the many reasons for housing crisis is going decades of underbuilding units of housing. Is the county taking more devastating action on developing those phrases that are public housing options, recognizing that the landscape of public housing is changed a lot towards more mixed use, making them part of the community. But has that being discussed or evaluated at the county level?
Well, the city and county both have initiatives that kind of look at affordable housing. And certainly affordable housing is in the big broad picture. But there are so many other factors that kind of drive the crisis why folks are on the street. We'll say a big part of this plan is while general affordable housing is outside of the scope, increasing specialized housing is very much in the scope, and there's 3 strategies under the plan that are being used for that. One is talked about where often landlords won't rent to folks. You know, sometimes it's because of the criminal history, sometimes it's because they don't have the rental history. Well, under the plan, a strategy that's pursued is called city or agency held leases, where a landlord is approached and say that they are guaranteed 3 years of fair market rent, and knowing that that will be occupied, they'll get that rent, and they can step aside, and also guaranteed that the apartment will be back to the landlord in the same condition that they rented it in. And then it's either the city or an agency that is able to sublease that then to individuals and not have so many requirements around prior rental histories, and able to then accept some of those federal programs that pay fair market rent. So city and agency held leases are one of the strategies to increase housing capacity. Another one is agency purchased properties. We're doing this now within the county with our Thriving Families program, and that's where an agency like Catholic Charities or Cooley Cap will purchase a property. And then they are the owner of the property, and they are able to accept government funds and other things. So both the city agency held leases, agency purchased property, and new development are all strategies in terms of how to increase specialized housing that the homeless will be able to transition into. Oh, sure.
And also just a comment for City of La Crosse. They recently did a study, it's available online, looking at the need of affordable housing for the city. And right now, because of not enough of it being done over time, is they're projecting needing 200 to 250 affordable housing units per year for at least the next 5 years. And currently they're doing about half that. They're doing about 100 units per year on there. And you know, that's huge, and one of the first steps they're looking at is zoning. That's one of the things they're looking at. I think they've done some things in reducing parking requirements. So every place doesn't need that many parking spots, because that affects activity there, and then just other zoning factors there that are being looked at. And I think it's one of the reasons there's a 5-year plan, because it's complicated, and a lot of these housing developments and other things can take 2 to 3 years to kind of put together. And so we're kind of looking at our current population, projecting where it is, and trying to define what types of housing is needed so we can start that journey. Yeah, more to be done there. The city does have a revolving loan, so for affordable housing, they can do a loan as that is paid back, that provides funds for more loans. It's probably not of the size that's needed. So those are some of the things we'll look at, is what needs to be scaled to fill those gaps.
Yeah, and just wanted to cap that off too is what was on one of those slides is the Collective, which is a city project. So different projects that are being built, there are a certain amount of apartments that are being set aside. In that one, there's 14. And what's good about this coordinated approach, now that we have the master list of individuals as well, we're making sure those apartments get to exactly where they're needed to reduce that unsheltered population. So that kind of coordination helps. Yeah.
Not to get too like deep into the weeds, but how much access do you folks have on the policy side or the side, either local taking care or
Yeah, we'll say that there's a growing contingent of cities that are bringing things forward under homeless response because there isn't a lot of support or help from the state in general homeless response strategies. So I would say there, from balance of state, and to know that's the state conduit of HUD funds, it's called, so federal funds. So we do work with them closely. That presents some barriers because there are a lot of bureaucracy and barriers, and there's a list that HUD has, and you can only access that if you're on the top of the list, whether it's a good match or not. What this plan really does, utilizing community resources, we're able to fill in those gaps around HUD and make this system a lot more flexible than it's set up by the federal government that you think sometimes don't want this issue solved because they put more barriers in place than anything. But we're able to complement that and wrap around that. Yeah. Yeah.
Yeah, so one of the things we've talked about doing and using the Faith Community Network is like our community resource officers have at a basic level just a resource quick guide, like where can you go for help and service there. So letting you know where the two shelters are that are right now, the Salvation Army and the Catholic Charities Warming Center. We're working with the Reach Center to make it more of a single point of contact where someone can come there and across a myriad of issues and get service. Because we're not expecting individuals to be able to have the skills and capability to do this effectively and safely. It's really about, yeah, you know, transportation is a surprising challenge for the system. So there are certain agencies that can transport and certain ones that can't. So I think for us to get that organized so you're aware, like who is able to provide transport and in what situation. As well as there's a crisis group, but there's certain criteria what would require, you know, where crisis would be involved, where the person would be either threatening harm to themselves or others. So we're working on that so there is a more effective, unified response so we can better answer that question.
I was just saying that because sometimes you don't have anywhere to call. Who I call.
Yeah, in the vision, no. Yeah. 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 Right. Yeah. Yeah. And that's where we're going to someplace very different than we are now. So for one, there won't be 100 individuals out there. They're kind of in the street in that situation. Everybody will at least have a place, and there'll be the type of outreach that can respond very quickly to be able to do the transports. That doesn't exist now, but that is part of outreach in the future.
Thank you very much. I know there's other questions. I can see this one right here, which I'm trying hard to ignore, but it's my mother. So, Jim and Jason are here for your questions. Jason, of course, is here all the time, so you can just grab him. But if you have other questions to ask them, this is not something that we're just doing today and then we'll never talk about again. It's one of our big 3 things. You'll hear about ways that we can participate and volunteer as those things come up. If this is something that is particularly hitting you and you have a heart for and like want to do more for, please see me, because that's how we'll make ministry here happen to the homeless. So Thank you, Jim and Jason, very much for being here. So